Hi, and welcome to this review of nurse staffing models. In this video, we will talk about how staffing models are established, as well as some of the details of patient-centered care, acuity-based nursing, primary nursing, team nursing, modular nursing, a 12-bed hospital, total patient care, and functional nursing. Nurse staffing models are rules or guidelines that determine the number of nurses needed to staff and schedule to provide patient care. Because patient needs in healthcare settings vary, different nurse staffing models are used in different situations, and an appropriate staffing model will consider all relevant factors. Nurse staffing models frequently involve nurse-to-patient ratios, or the number of patients under each nurse's care. Some states in the U.S. regulate the maximum number of patients per nurse in a specific setting, or provide other rules for deciding on an appropriate ratio, such as involving staff nurses in policymaking on staffing committees at the facility level. Research suggests that an increased number of patients per nurse is generally associated with an increase in adverse outcomes for those patients when other factors remain the same. Patient-centered care is a modern culture of care that has been demonstrated to increase patient satisfaction with the care they receive. Patient-centered care considers the patient to be a partner in his or her own care along with the healthcare team, and the individual's personal values and preferences are essential components in determining the plan of care. Acuity-based or acuity-adjusted nurse staffing assigns patients to nurses based on the intensity of care required instead of setting an absolute nurse-patient ratio. In practice, this process can rely on nursing clinical judgment to estimate the level of intervention necessary for each patient based on characteristics such as medical diagnosis and severity of symptoms, but an ideal system allows for an objective acuity rating. Primary nursing is a care delivery model that maintains continuity of care by assigning the same registered nurse to a patient for the duration of the patient's care encounter, such as an inpatient hospital admission. In this model, registered nurses provide most of the care, and some settings also include assistive personnel. In some more traditional primary nursing models, the registered nurse maintains responsibility for the patient's care even outside of a work shift, similar to a physician who is on call.